Hi, good morning. This is John Krieger. I'm Executive Director of WorldDenver. I want to welcome everyone onto our second in our series, the International Solidarity Series, that's co-hosted by WorldDenver and the German-American Chamber of Commerce here in Denver. For those of you, this is your first time with the International Solidarity Series. The purpose, what we hope to do here is to showcase all the ways that we around the world are experiencing things that are a lot the same and also some things that are a little bit different too. And we're happy to be joined this morning by panelists from Lebanon, from Russia, from Mexico. We hope to also have our panelists from Botswana, but that's really going to depend on the internet in Botswana, frankly. We had her yesterday for a test call, and hopefully she'll be able to join us at some point today. But I'll just start very quickly by introducing WorldDenver. We are an organization, a nonprofit based in Denver. We host international visitors from around the world, about 600 a year in a typical year, and from about 130 different countries. We also host about 15 to 20 events a year, featuring experts, diplomats, speakers, authors, and journalists on issues that matter to the world. And the one thing that our panelists have in common this morning is that they all came to Denver through exchange programs hosted by WorldDenver. And then I want to introduce my co-host, William Reed from the German-American Chamber of Commerce in Colorado. And William, if you could just introduce the chamber.
Yeah, absolutely. Thank you so much, by the way, John, for having us. Yeah, so as he mentioned, I'm the Executive Director of the German-American Chamber of Commerce Colorado chapter. We are an organization that has a similar vein to WorldDenver in that we are looking to facilitate and advance relationships and business opportunities between Germany and Colorado. And of course, there's a lot more of a worldview there as well, and some other international relationships. We're also super excited to be a part of this Solidarity Series. Similarly, we also host events throughout the year, bringing people together, a lot of networking opportunities. And one that you may be familiar with, especially if you're from Denver, is the Denver Christkindl Market, which is our annual fundraiser, which we look forward to celebrating our 20th year this coming December. So yeah, thank you so much, and looking forward to today's conversation.
Great. And before we get started with our friends from around the world, just a little bit of housekeeping. We're on a new platform this morning, GoToWebinar. We have some set questions that we have prepared, but we're also want to see where this conversation goes a little bit, and also have the opportunity for those of you who are participating with us this morning. I think we have about 100 people here with us from around the country and even from around the world. We'd like to take your questions as well. You will see a small control panel somewhere on your screen, and on that control panel is an icon for questions. If you click on that icon, it will give you the opportunity to submit your question. That will come to us, the organizers and panelists. We'll be watching those as we go, and then be prepared to answer them as the conversation goes on. If you don't see that control panel, look for a little right-facing arrow that will open up that control panel for you. If you have any technical difficulties, you can also let us know about those in that same kind of questions section. And then we're also recording today, and we'll have this available through a link as well. And I just see now that Florence in Botswana has joined us, and so welcome, Florence. I'm going to start with just the very first question, and that will be just to ask each of you to introduce yourself, talk a little bit about where you are, what you do, and then also, if you could, let us know where the program that you came to the U.S. through, and what countries what cities you visited while you were here in the U.S. So how about Tanya? Could you go first?
Yes, of course. My name is Tanya Awad Ghorra. I come from Lebanon, and I visited 5 states in the United States 2 or 3 years ago. I can't remember. I lost track of time. But I was under the program Voices of Reason, combating violent extremism. And I visited Charleston, Denver, Washington, D.C., New York, and Minnesota. Minnesota, yes, that's it. What I do for a living is I'm a professional media person. I worked for I have 20 years, 29 years of experience in the TV world. I'm a professional voiceover in my country and in the region. They call me the local Siri because I'm on the local mobile companies. I'm the voice that nags people. And I'm also, and this is the best part of, I think, what I do in my life, I'm a trainer on nonviolent communication and conflict resolution. I work with several organizations, but mainly with one organization named Adyan. Adyan in Arabic stands for religions, plural. We promote diversity and diversity inclusive citizenship. I train trainers, I create manuals, I work a lot with youth, and I'm a mother of 3 teenagers.
Great, thank you. How about Larisa? Could you introduce yourself?
Yes, the first thing I would like to say is thank you for the honor for asking to join you today. It's such a great meeting, so thank you, Open World. My name is Larisa. I'm from Russia. I live in Moscow, and as you can understand, English isn't my native language, so I probably will make a lot of mistakes, so I'm sorry for that. I visited the United States in the end of February. It was my first visit of the United States, and our program in Open World starts with Washington, D.C., and then we came to Denver and spent the lovely week. So it was a great experience for me. We visited some universities and knew a lot about program for entrepreneurship and startups and investigate innovation and how to make young people improve to start their own business. So about myself as a professional, I'm an engineer. I'm working in university like a researcher, scientist, teacher, and the university is Russian Chemical Technology University, so I'm a chemist a little bit. And now my professional interest in startups and entrepreneurship, so that's why I joined program of Open World. And I'm glad to be here tonight. So it's evening here in Moscow. Hope I will share with you some important information and have a good evening. So thanks.
Thank you, Larisa. And Eduardo in Mexico.
Yes, hi everybody. This is Eduardo from Guadalajara, Mexico. Guadalajara is the second largest city in the country, and I was there in Denver, also in Washington D.C., Austin, New Mexico, and well, and the West Coast. I was in Portland, Oregon. And my topic was renewable energy in the Western Hemisphere, and it was pretty interesting going to Denver and know all the culture, because I never been to this side of America, only the West Coast and New York, like, you know, the regular cities we visit. But it was very interesting and knowing more about renewables in the United States, and it was pretty enriched experience. So I'm 40 years old. I'm married to a French lady. So it's a pretty interesting mix. We have 2 kids, Louis, 2 years old, and Eva, she's 5. So imagine this lockdown with these 2 little monsters. But it's interesting, and it has changed our lives definitely.
Great. Well, so thank you. I want to echo John's welcome to all of you. If we can go ahead and start diving into questions about COVID-19. 2 weeks ago, pardon me, we talked to folks from Austria, Germany, Italy, and China. And across those countries, each country was responding in very different ways and at different levels at different times. So I was wondering if the 3 of you could talk to us a little bit about current policies in your own countries and what that's been like up to this point. And would we like to go in the same order, Tanya?
Okay. We had our first case back on February 22nd. It was a lady coming back from a pilgrimage in Iran. And the policy was aggressive immediately by the people before the government. People started to confine themselves, including myself, for example, in several regions. The government immediately closed, first of all schools a week later. So by the end of February, all schools were closed, but people were still free to move. But then the public opinion started to be loud because we're already having our kind of economical crisis. And then the government responded to this anger of people, demanding drastic measures by the government. So we've been on lockdown, and today it has been renewed for another couple of weeks. So I think we will not be outside our lockdown before the end of May, as everybody's talking about. Of course, not all people. Can you hear me? I'm here.
I'm sorry, there's a little bit of feedback.
Yeah.
Go ahead, Tanya. I think
Is
that might
that from my end? No, I think. Okay, so briefly, people are taking it really seriously. The government, despite not being a welcomed one, is taking it very, very seriously. We started bringing back Lebanese abroad to Lebanon, back to their country with drastic measures. Luckily for us, until now, we have only 582 cases of COVID-19. And we have 19 deaths linked to it. According to the World Health Organization and according to the international opinion, Lebanon is not only flattening the curve, we're now trying to smash it. So we're almost, until further notice, coming out of it. But people are really taking it seriously, mostly. Of course, not everybody, unanimity doesn't exist, so some people are still trying to go out, but the government, the military, the Red Cross, everybody is facing them and trying to put them back inside the houses. Of course, it has another facet. We can talk about it later on if you want. It has the economical facet on the people that work on a daily basis that have been out of work for over a month now. And that's another problem that we will have to deal with.
Thanks so much. Larisa?
Yeah. First cases, I think it was just in the end of January. And for the time, it's spread very slow. So it wasn't panic or something you worried about for every day. And just for the beginning of March, we didn't feel anything extraordinary or like it's a problem for Russia. So it's nothing was taken for the government about our country and something like that. But then we all for our country understand that it's a problem. The first thing was the same with Tanya said, it's shut down schools, children goes to their homes and continue teaching and learning some stuff by the internet. And I think it's about the middle of the March. Yeah, then we hear the news from our government that we have to stay in home. That's the lockdown is begin for the last week of the March. And now we officially announced that we have to stay at home for the end of the April, but I think we will stay at home for the end of the May. We can leave our homes for grocery store, pharmacy, and to walk with your pet, but not than 100 meters from the home. So officially it's a vacation time for everybody, for the whole country. So the business in some kind of problem, because if you employ, you have to pay your workers payments, even if they stays in home. So it's a kind of problem. Some people and like me, the staff who is working in the sphere of education, we are working from home. We try to connect with our children. That's they have their lessons online, and it's a kind of problem about exams. So they think the next year of teaching doesn't begin in the right time as it usually starts, but we try our best.
Thank you, Larisa. And I saw Florence, welcome. Thank you for joining us
thank you very
from Botswana.
much. Thank you very much. Hello, everyone.
Hi, Florence. I'm going to ask you to just quickly introduce yourself and just talk about what you do, where you are, and then also if you could share with us your experience when you came to the U.S., which cities you visited, and which program you came to the U.S. through.
Thank you very much. Once again, hello, everyone. My name is Florence Kenalemang. I'm from Botswana. That's where I am at right now. I'm a lady of 39 years of age, a teacher by profession, and I also do a lot of voluntary work here in my community when I'm not at work. The things that I really like to do, curbing the escalating numbers of GBV or gender-based violence that we see in our communities, in schools, and everywhere else. I also advocate for children's rights, especially the right to education. As I'm a teacher, I believe that every child has the right to go to school. Every child has to learn. So that is why I participated in the International Visitor Leadership Program on March 2016 under Voluntarism in Action. That's the name of the program. And then our first stop was Atlanta, Georgia. We also went to Washington, D.C., where we visited different organizations we were a team of 11 members from different countries. And I remember from my country, I had Honorable Member of Parliament, Dr. Penyubudali, and then we also had one lady from Nigeria. Then the other members were from Asian countries. And we moved to Philadelphia, and then in Philadelphia, that's where I learned about a lot of interesting history about the United States of America, where we learned that Philadelphia was the first capital city of the United States before it moved to Washington, D.C. And we also went to Rochester, where we went to Red Cross. And then at Red Cross, we also like initiated or taken on board as to know what really the Red Cross does, so that when we come back here in our country, we should do a lot of voluntary work. We should move to even deeper rural areas of our countries and try to help people in having social programs. Then from Rochester, I remember we went to Little Rock. Then from Little Rock, we went to Denver, Colorado, and Denver was our last stop.
And your best.
Hello.
Hi. Thank you, Florence. And Eduardo, part of the Solidarity series, we look at the ways in which we're a lot similar. And when you talk about having a 2-year-old and a 5-year-old at home with you, I have a 4-year-old as home as well. And I think one of the things that we're all learning is to better appreciate those who teach and take care of our children during the day. Can you talk a little bit about what you're seeing in Mexico personally and also on the government and economic side?
Sure. Well, this all started in by the end of February. The first case was the last week of February. A guy, a 35-year-old guy who came from Italy to Mexico City. And then more cases week by week, you know. But the feeling, and this is like everybody's feeling, is that the federal government was too slow to react to this problem. The first institutions who started to lock down were the private universities and private schools. Apparently, they have a more an international overview. Like I don't know. I would say it's a shame that the government reacted like 2 weeks after the private institutes, private universities, and some other companies, etc. But for example, in my case, my daughter, they stopped also the last week of March of February. They stopped, so we have been with her for a month now, and the school would send us every day, you know, the schedule, the activities. So now we practice as teachers, me and my wife, with her, and it was really difficult. John, you know this, and yeah, we appreciate the teachers, but we don't know if they are sending more work than they do in school. I don't know if you have the same feeling. Because it's too heavy and it's too much information and too much to teach them. That's still good. But the main thing, the main problem is that me and my wife, we both work, and we have to work from home too, and also teach and also take care of the 2-year-old. So it's kind of we feel like an octopus, you know. We have to do a lot of things at the same time, but still we are managing this. I think we are stronger than we thought we were, and it's all here. It's a mental game too, and now the government, the federal government said that we should be here lockdown. Well, the lockdown is until April the 30th. So here we are, we're still alive, and we have to wait. We have to be patient, and there's nothing more to do but to be patient and be creative with the kids. We have to be very creative, and that's it. I think the government, well, here we have local government, state government, and federal government. And I think the local and the state government are faster and they react faster than the federal government. And I don't think they are given the right number of cases and the right number of dead people. Here's an example. A week ago, California announced they had almost 7,000 cases. And just south of the border in Baja California, there were only 30 cases. So there, it makes no sense, you know. It's the busiest line in the world, the busiest place, San Diego and Tijuana, and we just don't understand why they are giving these numbers, the federal government. But apparently they just changed last night and they recognized that we have more cases than they were saying to the media. So yes, yesterday it was 3,000 and now we have 28,000.
Wow. And Florence, you have developments, things happening in Botswana just today, correct? On the political side?
Yes, sir. Like I was saying yesterday, a lot has been happening here in my country. We began social distancing on the 2nd of April, and it's going to end on April 30th, which is just 28 days down or extreme distancing. And we have seen a lot of policies being put in place as the government ordered businesses or shops to shut down so that people should stay at home. And then we have seen people being affected, or the informal sector being affected the most. The informal sector, for example, people like self-employed people who go to the mall to sell, people who work in salons, people who work in barber shops, people who sell in the streets. We have seen such people sitting at home and struggling to feed their families. Now, the question that has been being debated at Parliament is as how the government is going to assist such people, because it is not the same as myself, who is employed by the government and who knows for sure that by the end of the month, they are going to get a full salary. So today, this morning around 9 o'clock, the Minister of Health, Dr. Lemogang announced that from the 6 cases, COVID-19 cases that we have been having since the outbreak of the disease, today, this morning, he announced an increase of 7 more cases, which brings Botswana to 13 cases of COVID-19.
And so that's kind of a question. Obviously, there are different government responses. One, actual interventions to help to offer relief for businesses and individuals who are out of work. And there's also efforts to make sure that people adhere to stay-at-home orders and things like that. I'm interested, and maybe we could start with Tanya, since you're a little ahead of the rest of the world. It started in February in Lebanon. And if each of you could talk a little bit about what efforts are being done by the government, specific policies that you've seen over the last month.
Okay. I'll go first.
So I don't know if there's like feedback. Do I put my earphones on? Is it better?
I think you're okay, Tanya. If you want to go ahead and start.
Oh, yes.
Thank you.
Okay, I don't know if you followed a little bit our news, but we have a collapsed economical system, and this is why starting October 17, people took the streets to demonstrate and to uprise against a very, very corrupt economical system and a very. So we were already in a deep trouble. And the COVID-19 hit us when we had 45% of, what do you call it? Oh my goodness, I lost my word. When you work.
Unemployment?
What do you call it?
Unemployment?
Unemployment, thank you. I lost the word. Yes, yes. So we were at 45% of unemployment already. Now with the COVID-19 and with few months later, starting October, we are at 58.7 of people living under the line of poverty, which means people living with less than $5 a day. This had never happened in Lebanon. So the the new elected government has little means in their hands to respond. But in all cases, we have an amazing social strength, because we, as Lebanese, we always had to count on ourselves and on our social networking. So people started campaigns to bring food, to bring little money, to bring drugs, medicine to people who are in need. And it's happening on probably every street in Lebanon. What the government managed to do is open a line also for donations. And now they will starting tomorrow, they are starting to give to listed families the amount of $200, or the average that makes $200 for very poor families. I don't know if these $200 are enough or for a month, for a week, because our economy is again collapsed, and the power, the consumption of the consumer in Lebanon is already crushed. But the price we will pay is enormous, with 58.7% of below the average of poor, and with 50, I'm sure now we're over 60% of unemployment. Our bill will be very costly, but in the meantime, we are managing to help each other. I don't know anybody who's not helping anybody, somebody in Lebanon.
And Larisa, I'm curious to hear about government response in Russia.
Yeah, I think it's for me it's a difficult thing, because I'm in Moscow and it's a capital, and the all things in the capital and the DLCMA staff all isn't the same that's in the regions. It's a difficult thing, but if we are talking about the whole country, we have rise of the level of unemployment too. It's a problem, and I think we didn't feel the whole problem and the size of problem for now, but our government announced that it will be unemployment benefits, not very much, but for everybody who needs. And another problem for our country is the change of exchange rate. The cost of oil, it's very low, so our economy will decrease strongly, but it's now we are all thinking about COVID and our health and about lockdown. So not a, yeah, I think that's the main thing that everybody is thinking about. But if you think a little about future, and I do understand that the price will for everything will rise, and our payments wouldn't rise so much, so it's will be a problem for us. But for now, we all try to stay home, stay calm, and try to live for this day, not thinking a lot about tomorrow.
And Eduardo, you mentioned a little bit about how it's more local governments than the federal, and also in your email to us a little bit about how some people are responding well to recommendations and others just are not. Is that still what you're seeing in Mexico?
Absolutely. People in Mexico, well, Latin people in general, I'm saying in general, not all of them. It's a little, there's not a lot of discipline, in our behavior. The Latin people is more, Latin people. So what I think is that there's these two kinds of Mexicans: the ones that follow the rules and the ones that don't. And unfortunately, in this case of the coronavirus, we have seen many people outside. That's sad because we are trying to do our best to stay home, and it's very difficult. And then you go for groceries and you see people outside like nothing is happening, and that's a little desperate. I feel desperate sometimes. On the other hand, I see more and more people wearing masks, which is good. People is getting more conscious, but I think it's a little late. Hopefully, I'm wrong, but it's been a little slow to understand what's going on here in Mexico. This is Holy Week, and the next week is Easter week, right? So in Mexico, we have vacations these 2 weeks, and a lot of people were going that last weekend, Saturday, Sunday. They were going to the beach or to the mountain, to have vacations like nothing is happening. So luckily, the local governments are stopping them on the highway and sending them back home. And also, the military is now at the the popular beaches, because people go to the beach and they want to stay there. But now the military is there and then sending people back. You can't stay here, because that's how we understand. If we don't do it the hard way, we don't understand, unfortunately. And yes, local governments are now more participating with entrepreneurs, especially small businesses. Small businesses here rule the economy in Mexico. More than 80% of the economy is small and medium businesses and entrepreneurs. So this is a huge impact for our economy, because a lot of them had to close their businesses, and a lot of them they give work to 10, 15, maybe 30 people, and it's a chain, and it's really difficult. And also in the macro economy, hit us really hard too, the oil problem between Russia, hi Larisa, between Russia and Saudi Arabia. They hit the price, the oil price here in Mexico, and the dollar goes up, and the peso, our currency, goes down. So everything came at the same time. So now Mexico is like having a really hard time, but we have a lot of heart. That's the good part of Latinos. we have a lot of heart, and we are happy people, you know. So we try to do our best, and we try to help our friends who have businesses, who have restaurants. We try to order from their business, from their restaurants, so they don't close forever, you know. Now they're closed, but a little bit, because they can still send food. Food delivery is huge now here. Uber Eats and all other digital platforms are like working like crazy now, and we try to help our people, you know. We try to help our family or our friends that are struggling because they have businesses, and they have to, you know, they have to eat, and they have to give their people jobs. That's the most heartbreaking for me.
Thank you. And Florence, I believe that when you emailed us, you said that Botswana doesn't have confirmed cases of COVID-19, but you also are concerned that there's not much testing in Botswana. Can you talk a little bit about where things are right now in your country?
Yes, when we first spoke, when you sent me the first email, of course, I responded that there were no confirmed cases. And I continue to tell you that the way I see things is like are not ready for the pandemic. The way we were handling ourselves, or the way we are even handling ourselves as I speak at the moment. And some days after we spoke, or after I sent you that email, we first recorded the 4 cases and 1 death of a 67-year-old woman who traveled to South Africa. And then today we saw the numbers also rising to 13. And then you can ask me again to say, where are those numbers coming from? Who is being tested and who is not being tested? In this particular manner, all those people who arrived in Botswana from the 21st of March, they were put in quarantine, or they were put in isolated places. And the government used some hotels and lodges across the country in all the borders. Remember that Botswana is a landlocked country. We are in the middle of Zambia, Zimbabwe, South Africa. So all those people who are coming from these countries, African countries, and even abroad from America, from Europe, they were put in quarantine, and then they were tested. So there's 13 cases are coming the people who are in those quarantines. Then now we are asking ourselves, how about everyone else who is not in those isolated areas, or how about everyone who was not arriving from another country? So that's the question that we are asking ourselves at this moment. So we have been told that the people who are 16, because I said only one, we only have 1 death. So we have 16 patients who are at the capital city hospital, Mazire Hospital. So we have been told that they are doing very, very well. So we are hoping for the best news. Or what we are only worried about is that everyone else, although we are practicing social distancing, and like my brother here was saying that when you go to the shops, when you go to the malls, when you go out, you find like people are queuing up, people are gathered, people are like there's nothing happening, they are just living their normal lives. And then you ask yourselves, why are they crowding? They are putting their lives and the lives of everyone else at risk. You get what I mean? So we are just worried about those kind of situations, because today, like yesterday when I spoke to you, I said there's a special parliament session that has been ongoing, which ended today. So today, I did not hear any member of parliament or the minister of health talking about testing people in their homes or testing people in communities. I didn't hear any of that. So we are just worried, because we are even told that even if you feel like you have signs, you don't need to go to the hospital, just need to stay at home and call 997, then the health workers will come and attend you. Then the question is always, how about if they don't come to attend you, what do? You just stay at home? Because going out there to a clinic or a hospital, you are now becoming, making everyone vulnerable and making everyone at risk of contracting the virus.
Thank you, Florence. Eduardo, you touched on businesses. You're working from home right now. There are folks who still are operating their restaurants, but only for to go or delivery, as you mentioned. I was curious about the other countries as well. What is going on with businesses? I think one of you, Larisa, may have mentioned that it's essentially vacation time. So if you guys could tell us about what is business as usual and what is business as unusual right now. Tanya, could you tell us a little bit of?
Well, yeah, to go back quickly, of course, I mentioned it before, we were already in an economical collapse. So with the COVID-19 now, on a daily basis, we hear of big businesses closing and shutting down, not only medium and small businesses. Even the ones we thought that they were strong enough to get through a lot, these huge holdings are letting go of the smallest of their employees, the one they call disposable people. And we're talking about hundreds and thousands of families. And of course, the only businesses that are operating now, just like in Mexico, supermarkets, delivery restaurants, the restaurants that don't have deliveries are closed, pharmacies, and that's it. So if you have anything that is broken and you need repair, you can't. And it's the same story with hospitals. Everybody prefers not to fall sick right now because hospitals are not a welcoming place, and everybody is afraid. But on the working issue, online jobs are flourishing, and just like online courses. But online courses in Lebanon are not taken seriously. I don't know anywhere else in the world if it's more serious than here. Students are studying, but I think we were not ready yet to shift this big in a very short period of time. So it's just like an exercise to keep them in the loop, nothing more. And so for people who work remotely and from home and from laptops and who have some kind of not bad connection, it's okay. But unfortunately, for most of the Lebanese people, this is not the case. We are all connected, but it's a very highly priced service. It's like everything else. It's too much for any Lebanese to handle. The government offered few megabytes for free, but it's nothing that can help in these times where all we have is this connection. For the people who are taxi drivers, are handymen, are people who work, who can't use social network, these people are starting maybe a depression. And I think mental health is going to be the next thing we will go through on a global scale, not only in Lebanon.
Thank you.
Yeah, I think I'm next one. The same thing, things here in Russia, and a little bit difference between Moscow and the big cities like St. Petersburg or Yekaterinburg and the regions. So in big cities and in Moscow, it's disaster for small and medium business, and it's a lot of cafe and restaurants that are closed for now, and so they have to pay bills, rents, taxes, and they couldn't because they have no value. So government started some support program. It's a credit holiday, tax holiday in some kind. So they have 6 or sometimes 12 months to pay all bills in the future. And some movement about people, everybody tries to support locals, local manufacturers or some handicrafts, so try to support them and order some things from them through the internet. If we are talking about regions, so it's same problem that called Tanya. It's lack of internet and something about connection through the internet, and the level of unemployment rise highly for this moment already. So it's a kind of problem. Some interesting thing about local stores, they offer to cafe and restaurants shelf, like some place in the store that they may to sell some stuff they produce. Try to support them like that. I think that's what I want to say.
Okay, I'll go next. Okay, here in Botswana, since April 2nd, we have seen the government ordering all restaurants to close down. So all restaurants are closed down at the moment. Not even a single restaurant is open, and not even a single restaurant is operating. So the employees have been sent to go home, and we have seen a lot of quarrel or conflict between the employer and the employee, whereby some of the employees were told to go home. Some were told to take unpaid leave, and then some were even asked to write resignation letters. That is when the government introduced a COVID-19 relief fund, where the government injected 200 million pula to try and assist these businesses so that they can be able to pay rent, to pay electricity, and even to pay the employees even when they are sitting at home. Because sitting at home, it was not the intention of anyone else. Just like everyone else in the world, it's just being forced by how the disease is spreading. So in order to cap the disease, that is why we are isolating ourselves from everyone else and everything else. But I believe that after the 28th day, or after April 30, maybe we'll see businesses coming back again. But if we don't see them coming back again, or if we see another 28 days, an increase of 28 days being put on us here, such businesses are going to survive it, because Botswana, for a record, Botswana is a very small country with a population of approximately 2.3 million people. And although we have a stable economy, we are also stable politically, but you know, the way the virus is spreading is just scaring me, and is scaring each and everyone else. And we don't have even the capacity or those resources that we see in developed countries, which they are using in hospitals in order to care for the sick. We don't have such. So our question is, what if the numbers of patients increase, or the numbers of people infected increase? How are we going to handle the situation?
And Eduardo, we actually have a very specific question for you from my good friend Alejandra Garza. Hi, Alejandra. And the question is about the expat and international community in Lake Jalapa. Excuse me, Chalapa, and how that community is doing, and whether they have stayed or have gone back to their countries. And with a lot of that community being a retiree community, is that community safe?
Yes, actually, Chapala is a lake just next to my city, Guadalajara, and yes, it's the biggest American and Canadian population in Mexico, and well, the government of Canada started first asking the Canadian citizens if they wanted to go to Canada, and they would help them with the flights. And that was like 3 weeks ago. And because I don't know, maybe they saw something in Mexico that they didn't like, or maybe they saw that the future was not, I don't know, maybe it was not as they are expecting. So they just announced, they sent a message to all Canadian citizens in Mexico, and then just a couple days after, the American embassy asked also the Americans who live in Mexico, who are a lot, that they should go back to the States, to their hometowns. And some Americans are going back because now the weather is not as cold in the USA, but some others prefer the sunny weather of Mexico, and they say, well, if I'm in a lockdown, I rather stay here than, I don't know how is it in Denver now, but here is 85 degrees, like 28 Celsius. So it's pretty nice, and some Americans decided to stay forever here, and they won't move. But the ones that come and go, most all of them are going back home.
And I want to be respectful of everybody's time this morning. And so, oh, sorry, go ahead, Tanya. Well, I'll just ask
I
this.
just wanted to add a little thing about what Eduardo just said there. Okay.
Go ahead, Tanya.
Okay, no, there's a CNN report today that interviews were made with Americans in Lebanon, and thousands of them decided to stay here, not to go back. And they say for the first time, they feel safer in Lebanon than back in the United States. So they decided to stay. I think it has also to do with the weather, but also maybe they felt that we're doing okay in this COVID thing. So they prefer to stay here now.
Well, the one thing that struck me in all of your emails is you all ended with very inspirational and optimistic messages for us. And so if we could close today, if you could just share a little bit of optimism and just a little bit of inspiration and just kind of a short message to the people who have tuned in today. And we'll start with you, Tanya.
We have been given forcefully the gift of time to think the kind of world we want to live in after all this is over, because we're all in this together, as you heard us tonight, and as you will hear probably all over the place. So what kind of world do we all want to live in? Do we deserve? In my opinion, we deserve to live in a kind world, in an empathic world, in a just world where wealth is for everybody, because the earth is our home, is our biggest home. So, and me by myself and you by yourself, we cannot change this world. But if I decide and you decide to start living kindness today and justice today, inside our home, with our kids, with our children, I think we can create this massive wave of positive change to offer wonderful world for our children and for ourselves, because we deserve it, a kind world.
Thank you, Tanya. Larisa?
Yeah, I would like to say that I like this news about ecology we get now that our air became pure and water became pure. So I think I by myself think about this time of lockdown like some time for create some order in my life in the place that I live, to create a better place for living, and this is about my home and our home, like our cities and the planet itself. So be calm, everything will end good, and we will survive. And just we need some time to create a better new world.
Thank you. And Florence, some optimism from, or inspiration from Botswana.
Thank you very much to everyone here. Before we part ways, you are such a great panelist, and from most I've learned a lot which we don't have here in Botswana. Online learning and teaching, I hope is something that I need to look into, and also maybe practice for the remaining days, or if the days are increased. And then my last words or inspiration words, I can say with all the COVID-19, I've realized how precious life is, and I realized how one we are. We are one people, and together we can fight this one. And then to WorldDenver, I can say that for the international solidarity stories that you are bringing us together in order for us to share. So it's just inspirational. It just makes me believe that we can fight this together, and we can win this. And then I believe, and I've said to you before, that I believe that there's going to be a time that you are going to talk about post COVID-19 and share the stories and talk about the history, which we talk about at this moment, at the current situation. I believe that God is going to grant us the wisdom to see and the wisdom to live even longer, so that we can talk about this thing and even shape our future to make the world a better place for us all. Thank you very much.
Thank you. And Eduardo.
Well, I think this is a proof that we are more connected than we think we are. We are connected in many ways, and also in diseases. So this is a proof that we're not that different after all, right? And there's a book called Connectography of Parag Khanna, and it's a really interesting book. And the name says it all: connectivity and geography. It's connectography, and it talks about this. We're all more connected than we think, and I think there's also a winner after all this COVID problem, and it's Mother Earth. Have you seen the sky? And have you seen footage or videos and photos of animals going outside in the cities? It's amazing. It's amazing how Mother Nature, Mother Earth is responding to this. So I think it's a message for everybody that we have to be more conscious in all ways, in all senses, right? And we're more connected now with our families, with our kids, and I think we are more patient than a month ago. And yes, it's a lesson. I think it's a master's in human being.
Great. Well, there's nothing I could say that would be nearly as beautiful and inspirational as what you have all shared with us this morning, this evening, this afternoon, in your different time zones. I want to extend a sincere thank you for spending your time with us today. It is really nice that we're able to connect, even though we're all separate and distancing. William, did you have any kind of last thoughts?
No, I would just like to echo what Eduardo just mentioned, that this type of thing that we're doing right now is pretty incredible. We're connected truly across the globe. So thank you, WorldDenver, for putting this on and letting us be a part of it. And as John mentioned, actually at the top of this session, we're recording today's session as well as all of the other webinars that we've been hosting. So if you're interested in checking those out, definitely check out WorldDenver.org and GACC-CO.org.
And we'll do this again in 2 weeks. You all are a very tough act to follow, I'll say that. And I'll just mention again that the WorldDenver and the German American Chamber of Commerce were membership organizations, and so we hope that you'll join us. If you're interested, check out our websites, and also just please, we'll see you again in 2 weeks. Thank you again, everyone. Everyone stay safe, stay healthy, and we'll get through this.
You well, everybody.
Thank you.
Thank you.